Welcome to the MamasteFit YouTube channel. In this video, we're going to be breaking down 3 exercises that can help relieve one of the common symptoms associated with prolapse, which is pelvic heaviness. Hey, for those of you that don't know me, my name is Gina. I'm a perinatal fitness trainer here at MamasteFit, which is a prenatal and postpartum fitness training facility located in Aberdeen, North Carolina. MamasteFit exclusively trains pregnancy and the postpartum period, so we have this unique expertise of working with this time frame. And so in this video, we're going to break down 3 exercises that I love to recommend to my prenatal clients, my early postpartum clients, and beyond to help relieve the symptom of heaviness. And now heaviness may just feel like there's something kind of hanging out in your pelvic floor, and it may be associated with a pelvic organ prolapse, which means that your pelvic organs are just kind of sitting a little bit lower than they may normally. And so it's important to note that prolapse might just be a common thing that happens postpartum, and it's not necessarily associated with a decrease in function or an issue. Our bodies are just different after we give birth, but it doesn't mean that there's a problem. Now, if your prolapse is producing symptoms or it's affecting your function or causing a lot of issues, then yes, we obviously want to get some support. But I would almost compare a pelvic organ prolapse to having looser skin postpartum. Our bodies are just different. It doesn't mean it's less functional. However, the feeling of pelvic heaviness can still be frustrating and annoying to deal with, and it's not comfortable. And we may associate it with pelvic organ prolapse, but it could rather be pelvic tension. And so doing some of these exercises can help to release pelvic floor tension, which may relieve some of those symptoms of prolapse that you may be feeling. The first exercise that you can do is going to be a hips elevated breathing drill. And so you can take a bolster or a bunch of pillows and you're going to put it underneath your hips just to elevate them a little bit. And then you can just breathe here. So when we do diaphragmatic breathing, we want to think about a 360 expansion. So it's not all just to the belly. We're thinking my rib cage is expanding laterally into the back. And rather, if you focus on breathing into the back side of your body, you're going to feel more of a 360 breath around the entire core. The back muscles have a little bit more structure to them so they can withstand more pressure, and it's going to help target it more to the back half of the pelvic floor, which for a lot of us tends to be a little bit on the tighter side. So you can just do this position in the hips elevated breathing drill, and this is going to help to take gravity off of the pelvic floor, which may help to relieve some of those symptoms of heaviness. If you want to advance this movement or if you want to change it up a little bit, we can come into a more rounded position where you reach and grab behind your thighs and just kind of curl up into a little ball. But you can either lift your head up or you can keep it down on the floor, whatever feels most comfortable for you. But what we're focusing on is finding a rounded position in the back. So you're almost trying to curl and tuck the butt underneath to find more expansion in the back side of the body. And so we can take a big inhale and think push your back into the floor. And then when you exhale, try to curl a little bit more with your body. So this breathing drill can be a great option if you just want to take some gravity off the pelvic floor and just breathe here for a little bit. The next exercise that we can do is going to be a back expansion breathing drill. During pregnancy and sometimes in the postpartum period, we tend to favor a lot of extension. And because of that, the back side of our body tends to get very tight to include the back half of the pelvic floor. And so if you're having a lot of those symptoms of heaviness, it could be that the posterior half of your pelvic floor is a little bit tight. And so coming into a back expanded position can be really helpful. I like to take a pillow and fold it in half and then round and curl around it. And this really helps to prompt that rounded position. So in this position, we're looking for a big round in the back, and curling around the pillow can help to facilitate that. So when we inhale, we want to say inhale into this back space, down maybe into the low back area. And so we're expanding as much as we can back here. And then exhale, try to curl and round around the pillow a little bit more. You can also think about trying to pull the rib cage and pelvis close together on the front side of the body with an exhale. So you exhale to engage in the core to help kind of curl you a little bit more. So inhale to expand all into the back. And exhale, try to bring the rib cage and pelvis closer together and curl a little bit more to bring you a little bit deeper into this position. And as you're breathing into your back, you're probably going to feel more of like a stretching in the back half of the pelvic floor as well, which can help to release some of that pelvic floor tension. The final exercise that you can do is a little bit more upright, and it's going to be the hip shifted all fours position. So you're going to take a yoga block and place it underneath one knee. And this is already going to bring you into a little bit of a hip shift. From here, you're going to drive your hips towards that elevated knee, and it's going to bring more of a stretch in that elevated hip position. If you're having a hard time feeling this, sometimes having your partner put their hand against your knee so that you can press into it can activate the lower legs glute to help you move deeper into that hip. You can also do this against a wall if your partner is not available to give you some of this external feedback. From here, you should feel more of a stretch in this back hip pocket and just in this overall hip glute. And we're going to think round in the back to find more of that posterior pelvic tilt and rounded back position. You should feel a little bit more of a stretch on that elevated low back area. And then exhale, drop belly to the floor to find an arch. And so we're going to do pelvic tilt in this hip shifted position, which is going to help you move deeper into this one side due to the asymmetry of the position. So you can inhale or exhale to drop the belly down and then round in the back. If you're having a hard time finding that rounded back position, we can add some more external feedback. And so you can use a resistance band or a strap, and you're going to push the back into the band to find more rounding. And you're using the band to give you some of that feedback to help you move deeper into this position. So dropping the belly to the floor and then pushing up towards the ceiling as you take a big inhale into this back half of the pelvic floor. So the two external feedback things that you can include could be that resistance band and then your partner pushing against your lower knee to activate this glute to help you move deeper into that elevated hip. And it's going to help to really release this posterior pelvic floor on that elevated hip side. Thank you for watching this video, and hopefully these 3 exercises help you find some relief from the feeling of pelvic heaviness. If the symptoms persist or we're having issues figuring out how to do these exercises or we're having more pelvic floor issues, it can be worth connecting with a pelvic floor physical therapist or occupational therapist, either locally in your area, and there's a lot of online options, and we'll tag our favorites in the show notes below. If you like this video and you want more support in the postpartum period, join our online fitness programs. We have a free early postpartum recovery course that you can do from birth up until about 4 to 10 weeks postpartum. And it's a gentle guide to help you move your body in that early postpartum period. After that, we have our postpartum fitness programs that you can join to help support your return to fitness after birth. Our programs are offered in 2 formats, the Team Builder app, which is going to be a list of exercises with short demo videos, and a really great option for folks that like to work out in a gym setting. And then we have our on-demand videos, which is full-length workout videos that you follow and work out at the same time. We also have a C-section recovery program if you've had a C-section that's specific to helping you reconnect after a cesarean birth. And then we have sports-specific programs if you're trying to get back to running, Olympic weightlifting, or if you're a service member or first responder, we do have our military return to fitness program as well. So thank you for watching this video. If you want to check out any of our online programs, use code YouTube10 to get 10% off any of them. Be sure to subscribe to our channel so that you get notified every time we release new videos. We try to release a new video about once or twice a week. If you enjoyed this video, be sure to like it and comment below if there's any other things that you want us to help you figure out how to resolve in the postpartum period.